Thank you for staying with us on TVC News. Let's talk health now. It's possible for Nigeria to achieve a below 100 ratio by the year 2030 and a 300 maternal mortality rate in the year 2018, and that's if the government strengthens social intervention programs. The Minister of Health, Professor Isaac Adewale, made this assertion despite Nigeria's current rating as one of the least countries on the Maternal Mortality Index scale in Africa. Adewale noted that there is a strong correlation between maternal mortality and the level of social and economic development of any country. Joining us now is, the chairman of the Nigerian Medical Association in Lagos, Dr. Olumuyiwa Odusote. Thank you very much for joining us on TVC News.
Thank you.
The statistics are rather alarming. 576 deaths per 1,000 maternal mortality rates in Nigeria. So many have been wondering, how did we get to this level?
Well, there are several factors that has brought us to where we are. I guess one of the major factors is the poor economic situation we find ourselves, because one of the basic requirements to reduce maternal mortality is accessibility to health care. I know this is strongly tied to economic capacity of the individuals. So if the people are not economically empowered, then they will seek alternative to, properly equipped healthcare facilities. And that's what is going on in the country right now. I haven't said that, there has been a downward trend, actually, if you look over the last 10 years. But the rate of drop is a far cry from what we expect, and that's the reason why, there's a need to do something urgently, as other parts of the world have actually moved well ahead of us in Nigeria.
Exactly.
For us to be just second to the last, that means we need to do a lot.
But with the extent of, calamities that Nigeria has recorded at the quarters of maternal mortality rates now, with the minister saying that we can achieve a below 100 death rate now, how realistic is this?
Well, I guess one of the first they need to do is to determine precisely what are the major factors responsible for the high mortality rate. Like I said, accessibility to healthcare. Now, how many healthcare facilities do we have that are well equipped? And how accessible are they? And how affordable are they? What will have helped us in this country is health insurance. But you and I know the story of our attempt at health insurance. After several years, 15 years of health insurance, we only have about 3% coverage. So that's not going to take us anywhere. So there's a need to rejig the National Health Insurance Scheme to ensure that as many Nigerians, women, can afford healthcare, can be able to access healthcare, because that is a major factor. Though other factors also play a role, beliefs are there, but what will affect that will bring that drastic drop that we are looking at is to ensure that everybody can afford healthcare. As of today, maybe about 1/3 of Nigerian women
are covered.
Are delivered by skilled personnel.
Which also, makes me remember your earlier point where you said there are not so many choices now. So when they cannot afford the regular healthcare, they go for what they can access, immediately. But then looking at the causes of maternal mortality, hemorrhage appears to be one of the contributing causes of this rather alarming statistics. Now, when one looks at the primary healthcare facilities now, where exactly would you, expect or urge the federal government, to reprioritize?
Well, I will advise the federal government to invest massively in the primary healthcare, which is expected to see a larger percentage of Nigerians who are seeking health care. And if the primary health care system is strong, there should be an health center, at a reasonable distance to every person. which means that it can be easily accessible. And then if the health insurance scheme is also up and running, then it means it can be affordable. So the average woman will not have a reason to want to go and patronize a traditional birth attendant or a neighbor or to deliver by him or herself. Because what raises the death from hemorrhage is that a lot of these people are attended to by these unskilled caregivers who are ill-prepared to handle a case of hemorrhage, and many times they don't know what to do to even prevent the hemorrhage. You can agree with me that the best cure for any illness is to prevent it.
All right, doctor, let's also address, for many people now who have had their fingers burnt, so to speak, now, they didn't even go to traditional birth attendants. Some of them even had, their losses in hospitals. That one would have expected that, okay, you're in a hospital, you should be able to get the care that you're paying for. But then we see some doctors who are not really up to the task. What is the association doing in this regard?
Well, I'm not aware of doctors who are not up to the task. But what I can be able to tell you is that there have been a few cases of mishap in the hospitals. But if you trace those cases, the mishap actually didn't start in that hospital.
At that point.
I'd been there. So probably can say it's a failed attempt to save the situation that we have, at that point in time. And one of the major problems we have in Lagos, for example, now, is that the availability of blood is a challenge, because we have not developed a practice of voluntarily donating blood. You find an hospital with a capacity of, say, maybe 100 beds, having just 10 pints of blood in his blood bank. And then you have about 20 women in labor. So how do you cope with that?
All right, because of course there are some allegations, leveled at the quarters now of hospitals, doctors specifically now, who are not able now to rescue mothers or sometimes to save babies. But doctor, it's good to know that yes, your association is looking on ground. We hope that cases like this will get to be reduced now with all the points that you have mentioned. Dr. Olumuyiwa Odusote, there, the chairman of the Lagos State Nigeria Medical Association. Thank you very much for your time.
Thank you.